Good morning and welcome to our Facebook Live. We are filming from the beautiful Mooloolaba on the Sunshine Coast. My name is Courtney.
And I'm Cassandra.
Hi, we're going to be chatting today about the challenges of peri-menopause, and we've got a wonderfully experienced practitioner here, Cass, who's got lots and lots of info she wants to share. So we're going to just flesh out some information about what it is, what we can do and offer. And for anyone tuning in for their first time, we are an integrative naturopathy and doctors clinic here on the coast in Brisbane, on the Gold Coast and in Caloundra as well. So what we do is we offer a holistic service that can encompass all components of your health, your wellness, your diet, your vitality. We offer integrative pathology, psychology and GPs who can all share in the care of essentially helping you achieve your health goals by identifying the underlying issues. So, Cass, what's peri-menopause?
Well, perimenopause is that stage of your normal menstruation then leading on to menopause. So there's a lot of signs and symptoms that can go awry when we go through this stage in our life, and everybody's so unique. There's not one size that fits all. So symptoms could start with like insomnia or mood swings. Further down the track, you might have irregular menstruation or even hot flushes.
Okay. So in terms of some of the cases you've seen, and what are some of the strategies that you've found really works when you're talking to some of these women with their perimenopause?
I think first things first is just to understand what's going on as far as symptomology, but also looking at pathology testing. So here at the clinic we use a number of different tests, like we do a hormone test, which is very, very informative on how those hormones are actually in the body. Yep. So if there's any irregularities or any like high estrogen and low progesterone, we can then use our herbs to correct those imbalances. Perfect. Another thing that we use is also looking at neurotransmitters. So that's super important, especially with those mood swings. So we know as those hormones do become imbalanced, we also see some imbalances in neurotransmitters.
Okay, wonderful. So let's sort of just give a bit of an overview of treatment. You've mentioned herbs. What are some of the other things as naturopaths we can offer when it comes to treating hormones?
Diet is super important, so we can use food as medicine in helping our clients through this period. Also understanding their levels of stress, so doing self-care is also very important. We also have the luxury of having a compounding service here, so we can tailor make supplements to help with say liver function or balancing those hormones.
Awesome, fantastic. So in terms of some of the strategies and some of the turnaround times, would it be something that if I walked in off the street, would I say a couple of weeks and I'm going to feel really good?
No, it's a little bit longer than that, and really it does come back to the individual. It comes back to the compliance, and also we work with our clients and their lifestyle. So, for instance, shift working, it's going to take a little bit of extra time because we also have other factors in play there, but also just general lifestyle. If they're a busy mum and have a family of four, we have to work in with their lifestyle and make it as simple as possible so that they can achieve their health outcomes.
That's true. I've certainly worked with clients in terms of other hormonal issues, and it is something when we're treating, things happen on often a monthly swing, so it can feel like it can take a little time to see and feel the results. But when we work on all the elements that contribute to something like a hormonal shift, or whether it be a stage of life, and all the issues that Cass has mentioned that can contribute, your stress levels, your sleeping habits, your self-care habits, when we make those changes, they're often really, really long term because we've identified and assessed all the components. So we're not just walking out with this bottle of herbs that's going to zip me up and make me feel fantastic overnight. We're essentially doing a whole lifestyle change and a whole support that can carry on well into the months post-treatment, because the biggest passion I think most of us naturopaths have is in what we call wellness care. And wellness care is really the stage once we hand your health back to you in optimum functioning vibrancy. You've learnt so much through the journey with us here at the clinic that you're able to take care of yourself again. And the foods as medicine we've taught you about, and all the elements of your own environment and lifestyle factors that you're now aware of mean that you can keep yourself really nice and balanced and healthy.
Wonderful.
Groovy.
Thank you.
Awesome.
Now, peri-menopause is it's not a disease, it's a way of life, and we can help you with the symptoms. So if you want to find out more, please get in touch with the clinic, and we'd be happy to assess how you're going and get you feeling wonderful again.
Absolutely.
Okay.
And always, if you've got any comments, suggestions, feedbacks, questions, pop it in the section here in the video. Hit up our website or give us a call. We'd be looking forward to hearing from you. Have a good day, everyone.
Ciao.
Bye.